Hi everyone, my name is Vaidehi Mujumdar and I'm a second-year OBGYN resident. Today I'm going to present our qualitative study on the impact of COVID-19 on gynecologic oncology cancer care. I have no disclosures. The objective of our study was to identify patient-defined barriers and facilitators to GYN oncology care during the peak of the COVID-19 pandemic. From October 2020 to December 2020, we conducted 32 in-depth semi-structured phone interviews. The inclusion criterion included individuals receiving GYN cancer care at the Sidney Kimmel Cancer Center. We employed purposive sampling to establish patients with varying disease sites and sociodemographic characteristics. Interviews were audio recorded, transcribed, and summarized using in vivo 12. Our results showed that 16 out of 32 individuals, or 50%, stated that their biggest concern was contracting COVID-19. 28%, or 9 out of 32 patients, were concerned about exposure to COVID in the clinical setting. This included office visits, chemotherapy, and/or radiation treatments. 15 of the 32, or 47% of patients, stated that they had no concern about COVID-19 exposure. 7 of 32 patients, or 22%, also reported worries regarding cancer recurrence or progression due to delayed appointments. In general, participants were supportive of telehealth visits. 2 actually preferred virtual visits, while 30 preferred in-person visits. 7 of the 32 patients we interviewed, or 22%, reported transportation issues, which we'll get into on our next slide. Table 1 shows us the patient perspectives on GYN cancer care during the COVID-19 pandemic. We use 3 different buckets to illustrate patient perspectives. The first is the impact of COVID-19 pandemic on care. We further stratified that in 3 different ways by looking at the general impact on cancer care, concern from patients about COVID-19 transmission, and concern from patients about transmission in the clinical setting. In general, patients had to depend more on family members, and they were more timid to go outside. Some patients felt uncomfortable in the waiting room at their cancer care appointments, not knowing how often and the ways in which equipment was being cleaned. Transportation was another big concern for patients. Specifically, patients were concerned about Lyfts and Ubers and car services not running as frequently or being too expensive. They were also worried about taking the bus, which led to increased exposure to other people. Our third bucket was modality of healthcare delivery, which specifically looked at preferences for telehealth versus in-person visits, and if there were any technical challenges with telehealth. For some, telehealth was a matter of convenience because of how far they lived or issues with transportation. Other patients preferred face-to-face interaction. And some patients had trouble with the telehealth interface and had to resort to phone conversations. Our qualitative study showed the importance of understanding the concerns GYN oncology patients faced during the COVID-19 pandemic at a large tertiary urban NCI-designated cancer center. Thank you for listening, and I'm happy to answer any questions.